A very good afternoon to one and all. I am Arpita from the IGCP group. Welcomes you all to yet another session on the topic Red Flags for Delayed Motor Development in Infants and Toddlers. Now, I will give you a brief introduction of the topic. So, in recognition of the World Cerebral Palsy Day, we would request all of you to join us for this session on identifying early signs of delayed motor development in infants and toddlers. Early detection is crucial for timely intervention and improved outcomes in conditions like cerebral palsy and other developmental disorders. This webinar will highlight the red flags that clinicians, caregivers, and educators should be aware of during the first years of the life. Our expert speaker will discuss typical versus atypical development milestones, provide strategies for developmental screening, and outline the next steps for evaluation and management. And yes, we have with us someone very eminent and, of course, doesn't need any introduction in our platform. But still, to start with the session, I would like to welcome Dr. Sujit Tamboli, sir. Sir has done PhD in Development Pediatrics, FIAP. After MBBS, he has also done a DCH, PGDAP, PGDMLS. He is a consultant, developmental and behavioral pediatrician at Chiranjeev Clinic. Sir is a founder and director of First Child Development Center in Maharashtra since the year since the year 1992. Sir is a national chairperson of IAP Growth, Development and Behavioral Pediatrics Chapter 2014-15. He is an associate editor on textbook of Growth, Development and Behavioral Pediatrics 2024 and Central IAP EB member 2017 to 2019. So, sir, with this very brief introduction of yours, I would now request you to please start with the topic. Over to you, sir.
Thank you very much. At the outset, I must thank IJCP and Arpita for giving this opportunity. And we will straight away start as today is the Cerebral Palsy Day. So we will start with the developmental red flag signs in infants and toddlers related to the cerebral palsy also, and then we will have some developmental delay red flag signs for the other diseases. So up to 3 years, we will see what are the red flags and how we can identify them. So actually, disability can affect everybody, and sometimes in our lives it usually does. So cerebral palsy was first described by little WJ 40 years ago, and the prevalence is 2 is to 1000 population. Brain lesion is non-progressive. Motor disorder evolves over time. Clinical presentation can change, but this is not a single disease. So then cerebral palsy is a persistent disorder of posture and or movement due to a non-progressive damage to the developing brain, and the damage may occur either in utero, during birth process, or during first year of life. So it can happen anytime and can lead to cerebral palsy. Here important is the risk factors. So the risk factors which are there, they can be before birth, during birth, or after birth. So actually this during before birth, we can say that about the premature birth or low birth weight or central nervous system malformation or prolonged rupture of membrane or maternal hemorrhage or multiple gestation. So there are many causes which can be quoted as the risk factors for the cerebral palsy in case of before birth or during birth. What can happen that either vacuum delivery or delivery, actually it is a prolonged birth asphyxia, or patient has a breech vaginal delivery and high fever during delivery, or it can be perinatal problems. So and after birth, like hypoxic ischemic encephalopathy, so HIE, which is very common, then cerebrovascular accident, or There can be other problems which can be there, like CNS infections and respiratory distress syndrome, which is again very common in premature babies. Then artificial respiratory support, hypoglycemia. So all these can definitely lead to cerebral palsy, and these are very important risk factors which one should consider while considering the cerebral palsy. So you must take proper history before birth, during birth, and after birth. So that is very important. So the etiology which we saw, that genetic is 2%, neuronal migration disorder or developmental malformation, significant perinatal damage around 8 to 10%, birth asphyxia. Many people say that it is a consequences rather than a cause, and that is very important sentence. Then Apgar score low, hypoxic ischemic encephalopathy, preterm and low birth weight babies risk is higher. Periventricular leukemalacia or acquired birth insult like meningoencephalitis or head trauma, then severe neonatal jaundice also can lead to cerebral palsy. So during pregnancy, what are the causes? Like maternal infection during pregnancy, like torch infection, paravovirus, or other bacterial or viral infection. The genetic mutation. So actually, in Australian research, they have found at least 14% of CP cases are likely caused by genetic mutation. Then fetal hypoxia, that is placental insufficiency, or congenital brain anomaly. Then risk factors for cerebral palsy during pregnancy. So what are the risk factors, like RH and other blood group incompatibility, like AO incompatibility, then multiple pregnancy, maternal disorders like diabetes or hypertension, anemia, thyroid disorder, epilepsy, obesity, or cardiac diseases, and bad habits like smoking or drinking, which is nowadays increasing in mothers. So that definitely is harmful for the child. So alcohol or drug abuse, they definitely harm the fetus. And environmental factors like socioeconomic condition, healthcare quality, and ecological characteristics. So ecological characteristics, it is a new concept which is very important, and nowadays actually we should take care of ecology, because this definitely causes harm to the mother as well as fetus. So, what are the warning signs of early diagnosis of cerebral palsy? So, it can be actually poor head control, or arching of the back, or inability to actually hold the head. So, all these are actually this can be uh, sorry. So this can be definitely problems. Sleeping problems are there, eating problems are there, refusal to eat is there. Then body movements. So there can be different problems which are there, which can happen. So these are the early signs, and we should detect early signs, which is very important. So increase or decrease muscle tone, arching of back, then poor head control, inability to sit by 8 months. And here I will like to introduce only one scale, that is Denver of developmental observation card, where they say that at 2 months baby should have social smile, at 4 months head hold should be completed, at 8 months sitting should be completed, and at 12 months child should be standing without support and should say dada mama baba. And this is Dr. M.K. Sinayer's DOC, or developmental observation card, which definitely helps us to diagnose it early. And that's why we should keep that also in the mind. And with this either tone abnormalities or epilepsy or seizures or eating problems, or body movements problems or arching of back. All these are very important. And head control and sitting. Then actually we have in my PhD thesis we have correlated that delayed sitting as well as delayed neck holding definitely correlates with the detail testing like DASI. So they are very important milestones which we should keep in mind. Then what are the signs which are useful in early diagnosis? Lack of alertness, then decreased spontaneous motility, stereotype abnormal movements, and poor quality of sleep. So all these are very important warning signs. So these are the important warning signs which, according to the age, they have been shown in the this thing figures form. Then what are the abnormal signs? That is reduced head circumference, like microcephaly, failure to thrive, persistent fisting with adduction of thumb, that is called as cortical thumb, beyond 2 months. Because before 2 months, this is normal. But after 2 months, if the fisting with adduction of thumb occurs, then it is abnormal. Then delayed developmental milestones, which I have already referred. Persistence of primitive reflexes. So we should know that moros disappear by 3 months. But if it persists more than 3 months, then definitely we should look for the other neurological anomalies. Then abnormal posture and gait. That is also one of the important abnormal sign for cerebral palsy. Toe walking again is very important. The delayed appearance of postural reflexes. So that is again very important. Then persistent tone abnormality. So it is very important that the tone abnormality, many times what happens that up to 6 months, tone abnormalities can be overcome by the child. So if it is overcome, then don't try to be in hurry to label that child as a cerebral palsy below 6 months. So it is very important that if the tone abnormality remains there after 6 months, then only you can call that as a persistent tone abnormality, and then we can think of cerebral palsy. So persistent asymmetry in posture, then abnormal movement and or hyperreflexia, then oculovisual problem. Oculovisual problems, which are the oculovisual problems which are common in cerebral palsy, which we should look for? Is roving of eyes, no visual following, nystagmus, or persistent squint. Then lack of auditory response, which is again very important abnormal sign for the cerebral palsy. Then what are the clinical features of cerebral palsy, which gives classification wise? So increase or decrease muscle tone, arching of back, poor head control, inability to sit by 8 months, then seizure or epilepsy, random or uncontrolled body movements, then eating or swallowing problem, balance and coordination problem, then behavioral problem, learning difficulties, sleeping problem, visual problems. So all these are the important clinical features. Then what are the common comorbidities? Which these patients do have intellectual disability, or they may have persistent seizures which are uncontrolled. Then they have behavioral problems, difficulty in speech and language, then swallowing and feeding difficulty, drooling of saliva, then sleep disturbances and malnutrition. So these are the common comorbidities. Then how to recognize cerebral palsy? So here we can see the child is limp or floppy. There is a slow development. Then there may be feeding problem, but baby may not be sucking properly, and body stiffens like a board. So that is these are the important signs which we can recognize about cerebral palsy. Then actually here events leading to cerebral palsy has been shown, where the perinatal asphyxia can cause this, which is very important. This thing. So preconception, perinatal or postnatal, and cerebral palsy like spastic or dyskinetic or ataxic. So these are the important type. Actually, here uh, we have mentioned what are the different types of cerebral palsy. So what is the commonest is the spastic diplegia. Here in spastic diplegia, more commonly intelligence is normal. So that is very important because we have one child who is now doing MBA. He is a case of spastic diplegia, and we have followed him since birth only. We have given him many injections and therapies, but now he has responded well, and then he has done his graduation in pharmacy, and he is doing MBA. So which is very important. So ataxia is another type of cerebral palsy, spastic quadriplegia, hemiplegia, dyskinetic, and mixed CP. Dyskinetic CP has not good prognosis, and we should be very cautious about giving medicine. So, spastic or dyskinetic or ataxic CP, these are the important things, and causes has been shown here in the which area of the brain, like prenatal, natal, postnatal, dyskinetic CP, or all other has been shown. So we know that various classification of cerebral palsy, where it can be four types of classification: physiological, topographical, etiological, and functional. So spastic, athetoid, rigid, ataxic, tremor, atonic, mixed, double or unclassified is the physiological classification. Topographically, either monoplegia or paraplegia, hemiplegia, triplegia, quadriplegia, or diplegia or hemiplegia. So these etiological classification can be prenatal, perinatal, and postnatal. And functional classification, where class 1 we have limitation of activity, class 2 is slight to moderate limitation, class 3 is moderate to great limitation, and no useful physical activity. Here we should remember that while giving the diagnosis of cerebral palsy, we must give what is the physiological classification stage, what is the topographical, what is the etiological, and what is functional. So whole diagnosis should be given. Like spastic hemiplegia, cause is perinatal, and it is a class 2 type of cerebral palsy. So that type of things you can quote about the while giving total clear diagnosis. So then developmental red flags from first to 3 months. What are the first to 3 months red flag? That child doesn't seem to respond to loud noises, doesn't follow moving object with eyes, does not smile at the sound of your voice. So that means social smile is not appear. Does not grasp and hold object. Actually, whenever you give object pain or something like that, baby grasp at 3 months. But if baby is not getting that or not holding object by 3 months, it is definitely alarm, and you should show to your doctor. Then don't smile people at 3 months, cannot support head at 3 months, even if up to 4 months you can say. But if baby is not supporting the head, it is definitely alarming. And doesn't reach for or grasp toys by 3 to 4 months, or doesn't bring objects to mouth by 4 months, doesn't push down with the legs when feet are placed on the firm surface by 4 months, and has trouble moving one or both eyes in all all directions. Then crosses eyes most of the time. The occasional crossing of eyes is normal, but crosses eyes most of the time is abnormal. So doesn't startle at the loud noise, doesn't briefly follow moving object, doesn't respond to loud noise, brings hands to mouth, then doesn't smile at people, cannot hold head up. and does not bring hands to mouth, does not chuckle in response to you. So these then 4 months does not watch signs as they move, doesn't smile at people, cannot hold head steady, does not coo or make sound, does not bring thing to mouth, and does not push down with the legs when the feet are placed on the hard surface, and has trouble moving one or more both eyes in all directions. These are very important milestones at 4 months that you should look for. These are the red flags. And then 4 to 7 months seems very stiff or tight muscles. That's why persistent tone abnormality, which remains after 4 months also. So seems very tough, stiff and tight muscles. Seems very floppy, like a rag ball, a doll. So some may have tight muscles like hypertonia, or some may have floppy legs like hypotonia. Head still flops back when the body is pulled to sitting position. So by 5 months, still exhibit head lag. Means actually many children, they when they pulled uh, uh, to sitting position, their head is not steady. Shows no affection for the person who cares for them. Does not seem to enjoy being around people. One or both eyes consistently turn in or out. Persistent tearing, drainage, or sensitivity to light. Does not respond to sound around them. Has difficulty in getting object to mouth. Does not turn head to locate sound by 4 months, which is again very important that whenever you ring a bell, child is not turning head to locate the sound by 4 months is abnormal. Does not roll over or stomach to back by 6 months, cannot sit with the help by 6 months, does not laugh or make squealing sounds by 5 months, does not actively reach for object by 6 months, and does not follow object with the both eyes, and does not bear uh, some weight on the legs by 5 months. So at 6 months doesn't try to get things that are in their reach. What happens that children, they do try to take the objects in front of them, but at 6 months even that child is not trying, it means that there is abnormal. So shows no affection for caregiver, does not respond to nearby sound, has difficulty in getting things to mouth. This is again very important that many child, they are getting things to mouth. Seems very floppy, does not make vowel sounds such as a, e, u, does not roll over in the either direction, does not laugh or make squealing sound, and seems very stiff with tight muscles. So all these are very important. Then at 9 months, what are the red flags? That child is not bearing the weight of with the legs on. It's not bearing the weight on the legs with support. Doesn't sit with the help, doesn't babble such as mama, baba, dada, doesn't play any games involving back and forth play, doesn't respond to own name, doesn't seem to recognize familiar people, they does not look where you point, does not transfer toys from one hand to another, which is again very important. So transfer of objects, if it is not there by 9 months, it is definitely abnormal. Then again here 8 to 12 months does not crawl, cannot stand when supported, says no single word, does not sit steady by 10 months, does not show interest in peekaboo or patty cake, and does not babble by 8 months. So 12 months to 1 year, whenever they does not crawl or does not stand when supported, they do not actually search for things that are hidden from sight while your baby watches. does not point to things, does not learn gestures like waving bye bye or shaking head no, and does not say single words like mama or dada, loses skills once had. Actually, here, point to remember is that waving of bye bye appears at 9 months, and shaking of head no is again at 9 months to 10 months. So, if it is not appearing even by 12 months, then it is a red flag. So 12 to 14, 24 months. They cannot walk even by at night 18 months. Then fails to develop mature heel to toe walking pattern after several months of walking or walks exclusively on toes. They does not speak at least 15 words by 12 months. 18 months. Does not use two-word sentence by age of 2 years. That is 24 months. By 15 months does not seem to know the function of common household object like brush, telephone, bell, fork, or spoon. Does not imitate action or words by 24 months. Does not follow simple step instruction by 24 months. So 24 months they does not point to show the things to others. So they cannot walk also, and does not copy others. Does not know what familiar things are for such a spoon or cup. Does not gain new words. Does not say at least 6 words, and they do not notice or mind caregiver and lose skills once had. At the 2 years does not know what to do with the common things such as brush, phone, fork, or spoon, does not copy action or words, does not follow simple instruction, does not use two-word phrases like drink water, and does not walk steadily, loses skills once. Then for 24 to 36 months. So we are going to finish this after 3 years, because 3 years is the limit we have been told today. So, frequent falling, difficulty with the stairs, persistent drooling on very unclear speech, inability to build a tower of more than 4 blocks, difficulty in manipulating small object, inability to copy a circle by 3 years, inability to communicate in short phrases, no involvement in pretend play, failure to understand simple instruction, little interest in other children, extreme difficulty in separating from primary caregiver. So here, even few children they cannot jump at a place, cannot ride a trike, then cannot grasp a crayon, cannot copy a circle, cannot stick 4 blocks, ignores other children but show no interest in interactive games, then does not engage in fantasy play. They does not use sentence for more than 3 words, and they use me or you as appropriately. So developmental milestones, these are the again things which has been given in a very big manner, that physical problems where we have divided that into fine motor and gross motor, then cognitive, language, social or emotional, and self-help. So whenever there are milestones, in which area they are there and how they can be helpful to us is very important. So at 1 month to 4 months, what we are uh, actually planning here, to ask the mother regarding the milestones, that purposeful grasp or transfer of object from hand to hand, plays with the fingers, hands and toes. Then visually track through the midline, roll over, head lag disappearance, play with the feet, exercise his body by stretching and moving, and touch genitals, rock or on stomach or for pressure. Usually, this respondents to objects or faces as they move, and reacts to sound of voices and Here, important thing is that we today has been told about fine motor and gross motor. So motor developmental delay. But I have shown this slide purposefully because there are other areas also which are important and they can be associated as a feature of cerebral palsy. So cognitive, language, social, emotional, or self-help skills are very important. Okay, I think we'll finish this off because time is over. 30 minutes are already over. So we'll not go into the details of all these charts. Okay, but most important to conclude is that we have to look for the tone abnormality and milestones like head holding, then sitting, and standing and walking. So all these are the important milestones we should look for. Thank you very much.
Thank you, sir. Thank you so much for the enlightening talk. Now, sir, shall we take the questions from audiences?
Yeah, you can.
Right, sir. Sir, the first question is: can delayed motor development in infants can be an early sign of broader developmental disorders such as cerebral palsy or autism? And how can pediatricians differentiate between isolated motor delays and more comprehensive developmental challenges?
This is very important question where we must know that what is development initially. Actually, can I stop this slide sharing?
Done, sir. I think there's some network issue. Please allow some time.
Join. Ah. Okay. So the most important thing is that development occurs in the six areas. Which are the six areas? Gross motor development, fine motor development, mental development, social development, expressive language, and receptive language. So all these six areas we have to look for the development from 0 to 6 years. So their question is that how we can differentiate between the autism and cerebral palsy. So for autism, no motor developmental delay is there. But in cerebral palsy, definitely there is a motor developmental delay. So that is the big difference between the autism and cerebral palsy. The next one is that for first year, autism diagnosis is very difficult. Although MCHAT is available from 6 months to 18 months, but diagnosing autism at around 18 months or 24 months is very commonly seen. But diagnosing cerebral palsy we can do at 1 year also, and by the abnormality of the tone, then abnormality of the motor milestones, means gross motor as well as fine motor, and according to that we can see. So suppose the child is not able to sit on his own even by at 1 year or 1.5 years, that is definitely abnormal. Then child may not be standing or walking at 1.5 years or 2 years, then it is abnormal. No, child doesn't have pincer grasp at after the 1 year, then it is definitely abnormal. So we have to look for the proper motor as well as gross motor as well as fine motor signs, and then we can differentiate. Thank you.
Right, sir. Right. Thank you, sir. Thank you so much for answering the query. The next question is: what role does early intervention, such as physical or occupational therapy, play in addressing motor developmental delays in toddlers? And when is the optimal time to begin with these interventions?
It's very nice question. Actually, Here we must know that early intervention should start at NICU level. Means what I have did is my PhD, where follow-up of high-risk newborn was my topic, and we catch the high-risk newborn because we have seen the slide where what are the high-risk factors for the cerebral palsy. So we know that these are the factors where we have to pick them up early. So when early is means that at the time of the NICU discharge. So at the time of NICU discharge, mother should be considered as a therapist of the child, and she should be trained in what type of exercise she should do, what are the things, what are the toys she is going to play with the child, and how they can do the activities. So that are they are all very important. And for that, two standardized Indian stimulation programs are there, which can be used. One is Trivandrum Bal Vikas program by Dr. M.P. Sinayar, and the second one is actually there is an Indian version of the Portage Education Package, which is done by Dr. Tehil Kohli from Chandigarh. And here also, what they have done is that uh, हिंदी में है वो कि जैसे कि बड़े स्नायु का विकास, छोटे स्नायु का विकास, भाषिक विकास, ऐसे लिखा है। और समझो दो शब्दों का वाक्य बनाना, आपने क्या करना है। सो फॉर मदर देर आर इंस्ट्रक्शन 1 2 3 4 5 एंड सहायक खेल सामग्री। तो ऐसे हर चीज का, जैसे कि जन्म से लेकर 6 साल तक 106 से 110 आइटम हर एरिया में दिए हुए हैं। So that is very useful program, and we should start immediately at birth. First thing. Second thing is that they have asked about the toddler. So for toddler, actually what happens that there is a delay if you start in toddler age group. You should start it at earliest as possible. So whenever you catch them, then if it is a delayed tone abnormality, and you catch them at 2 years of age, that child is not standing on his own and all, then you need therapy by the physiotherapist, occupational therapist. For autism, occupational therapy is very important, and for the cerebral palsy, physiotherapy is very important. So we have to give physiotherapy as well as occupational therapy and toy stimulation program, as well as medicine if required. Suppose there is a severe hypertonia, then we should give muscle relaxant. So such type of therapy should be planned. Any more question, Arpita?
Yes, sir. There is one or two more question, I guess. Checking, sir.
Okay.
Sir, how do factors like premature birth, genetic conditions, or environmental influences contribute to delayed motor development? And how can early intervention mitigate these effects?
Yeah, actually, all these factors which are there, they can damage the myelination, and they can affect the motor development. So for them, when we diagnose them, it is very important that at what age you diagnose. And what I feel is that you should diagnose it at earliest. So ECD program by IIP is a wonderful program where we can diagnose them uh, at earliest. Even the actually mother child care card, which is given by every mother by the government of India, is a very nice card, and that is available in all languages. And there also they have given green, red, and yellow, the milestones, and that milestone should be catch up. And if you catch them early, then you can treat them. That is the important thing. So if premature baby, or babies who are having some brain hemorrhage or something like that, all problems are there, they can damage the motor areas, and then that's why there is a delay in the motor development. And then what we have to do is that अभी ये ब्रेन काम नहीं कर रहा है तो इसके बाजू वाला ब्रेन काम करेगा, लेकिन वो बोलता है मैं ट्रेन नहीं हूँ, मुझे ट्रेनिंग दे दो। फिर वो ट्रेनिंग देने का मतलब ही थेरेपी रहती है। तो वो दूसरे ब्रेन को जो बचा हुआ है उसको जो ट्रेनिंग देंगे, वो ट्रेनिंग जो होगा, क्योंकि वो ट्रेनिंग ऐसे रहेगा कि पूरा एरिया वो कवर करेगा। कि जैसे कि अभी एक आधा बच्चा हाथ नहीं हिला रहा है, ऐसे ऐसे नहीं हाथ हिला रहा है, मतलब ग्रिप नहीं है उसकी आ रही है, तो उसको मैंने बोला था कि इनको स्पंज का बॉल दो, मिट्टी के आकार बनाने दो। तो उसके मम्मी ने वो सब किया, और उसने और एक किया कि उसको ये मनगटी रहती है उसको ऐसे छल्ला लगाया, वो छुम आवाज आने के बाद में वो बच्चा ऐसे करता था। तो whatever type of exercises you are suggesting is very important that they should be clear and they should be target oriented, and that is very important.
Sir, is there any effect of COVID-19? For example, if a mother suffers from COVID during her pregnancy, does that in any way affect the developmental delay or anything else in the newborn?
Uh, Not much cases are there because COVID-19 was the viral this thing, and due to that, actually, what happens that premature delivery and birth asphyxia and other factors which cerebral hemorrhage and all, they are important. So if they are there due to COVID, then they have affected the child. So not per se due to COVID, but the complications of the COVID, like premature delivery, because of COVID, it happens in many conditions, low birth weight, or maybe asphyxia, or hemorrhage like HIV. They are more important factors.
Right, sir. Sir, so these were all the questions for today. So I would like to thank you for answering all these queries and for your very enlightening and insightful presentation. Thank you so much, sir, for putting all the effort to make this session an engaging one. Thank you so much, sir, once again. And we are looking forward to do more sessions with you. Thank you all. Thank you for putting up the questions. So
Thank
we are closing the session for the day. Thank you all.
you.